So as of today, I guess we've lost 124 West Virginians, and my heart goes out to each and every one of their families. With this COVID-19 pandemic, we have more than 7,000 that have been tested positive. We have more than 300,000 West Virginians applied for unemployment insurance in West Virginia. People are hurting. And now with the unemployment benefits, as far as the additional money for unemployment benefits, now people that are still unemployed are going to get their regular unemployment checks, basically whatever their formula. And I think the average check in West Virginia is $320 a week. That's a far cry from the $920 with the $600 spiff that they had on top of that. But I think there's going to be an agreement, hopefully, very soon. And it's a shame that we couldn't work out something sooner. But I will say again, if Mitch McConnell, as a majority leader, would have called us all back and says, we're going to have a working group a month ago, we knew this deadline was coming, we could have gotten through this. I've been having some really good faith conversations with a lot of my fellow colleagues on the Republican side, and we're not, when we talk to each other, we're not that far apart. But I guess both the leaders are looking to their base and their national bases, and it's much different negotiation. So I want you to know where I'm coming from, and I've been able to talk to Steve Manchin. I've been able to talk to everybody that's doing the negotiations. I says, you know what, you are in negotiations on a level that I'm not, but I'm going to tell you where I am, that for me to vote for anything, there's going to have to be money for rural hospitals, dedication fund. I said, we've lost 3 hospitals in West Virginia. So the money for rural hospitals be dedicated to 20%. That should be a $40 billion. They've gotten 11 so far. I'm assured that there's going to be extra money for our rural hospitals that will keep them moving. And about every hospital in West Virginia is considered rural with the population base we have. So we're fighting that. We're fighting the PPEs and plus more testing. There's not a person in West Virginia who shouldn't be able to get tested, and they shouldn't have to pay for it. We have put enough money towards this, and that was the money that went to the states, too, to be used for those purposes. The state has done some of that. Much more needs to be done. So that, and then homelessness for children, myself and Lisa Murkowski has been pushing that. I think we'll get some assistance there. We've asked for at least $800 million, and what that is for, that's going to be basically for the children and families to assist families and children and youth. So that's what we're working on now. It's an Emergency Family Stabilization Act is the name of it. And they're just getting inundated right now trying to have enough of the people with professional skills to be able to serve the demand that's out there. You have the opiate epidemic that we've had has devastated families and destroyed families and children's security. And on top of that, you have a COVID-19 when a lot of them have had elderly people taking care of them and caring for them, and it's created a tremendous disaster all over America. We have 1.5 million students facing homelessness in this country, over 10 to 11,000 in West Virginia. 1.5 million. There is roughly 7 million children living in a house with overdue rent that could be called on. So I can just it's a bomb waiting to go off if we don't do something. So we're working on that. We have the thing that we asked for the most is, how do you expect us to navigate a the COVID pandemic that we're in for at least the next 5 months that you're telling us it will last before you have a working vaccine or an antibody? How are we supposed to navigate that when we don't have connectivity? When it's so sparse throughout our state and most of the rural areas of our state, doesn't have good connectivity, broadband, high speed, any of that. So we have a bill, myself and Lisa, and myself and Susan Collins, a Republican from Maine, which is on hotspots. And we have gotten that into Steve Manchin. He's put that in his request. I think we're going to have that one to where we're able to have in all of our libraries, rural libraries in West Virginia, you as a citizen of that area can go and check out a hotspot to give you better connectivity or give you connectivity for the first time in that area that you live where that library is, so that you can do telehealth or you can do distant learning, you can do your homework, things of that sort, same as you check out a book. So we think that's going to be, and we've got Democrats and Republicans both having tremendous problems and challenges with connectivity as far as broadband and high speed. So those are the things that I was really concerned about, and also I'm still very much concerned about the local communities that were supposed to receive 45% of the funding of the $1.25 billion that came to our state and $150 billion that went across the country. And I'm talking to Democrat and Republican senators, and they're all aghast at not getting this money to the municipalities or to the counties or to the first responders or to the health departments, the people that basically are going to be making decisions on do they lay people off or whatever because of lack of revenue, that we could have backstopped that. I'm still very encouraged. I'm encouraging the governor and everyone who's making these decisions to please consider those communities on a basis that's basically population that's fair. Don't make any political decisions. Base it on the population of a county, population of a municipality, the amount of COVID cases that they have, and the need that they have to basically fight off these expenses that come because of the pandemic. That's exactly what the money was used for. And right now, we have Republicans that are saying, we're not putting another penny out. We're not giving anybody another penny in these states. And we're saying there's going to be some money that's needed. We just got to make sure it gets to where it's supposed to get to and does not have the discretion of anyone in a political position, such as a governor in any political party, Democrat or Republican, who make the final decision. So any money that basically 55% of that money that's supposed to go to the state should be done with the approval of the state legislature through a process that we've always done. You know, this is federal money coming in. It's not a governor's money or anyone else's discretionary money. And then the 45% has to be an automatic pass-through. Automatic. They have no discretion. The legislature doesn't have any oversight. Governor has no say whatsoever. It goes directly based on population and the COVID-19 related expenses, period. So those are the things that we've worked on. Now, I can tell you there's still a lot of conversation going on about what should the unemployment benefits be. I don't see them remaining at $600. I think they're going to be anywhere between $350, $300, and $400. I think they will come to that agreement. That's my gut reaction. That's my feeling. And talking to my fellow colleagues on both sides of the aisle, the Democrats from the House of Representatives passed their HEROES Act, which had the $600 extended to the end of the year. I think really what needs to be done also on top of helping people through these most difficult times is to make sure that every state is using the money that we might get a new tranche of money to use that to upgrade their systems so they can best track every employed human being, whether they pay state taxes, federal taxes, whether they're in the system or not. Anybody that's paid a state or federal tax, we have knowledge of what they're making, what they're paying off. Right now, they're telling us we can't figure that out because so many people have been added to the unemployment rolls that we're paying the $600 and never were involved in the unemployment system. So that's why that's caused a snafu there. And that's why they're using a number, whether it be 600, 400, or 200, they're using a number rather than a percentage of what you pay. I've always taken the position from day one that if your job, if you lost your job and we closed the business you worked at because of the pandemic, because of the medical crisis, then you should be able to draw your full salary from unemployment benefits until we get the economy back up or have a working vaccine, until things start opening up and your job comes back. You should have been taken care of 100%. Well, they said they couldn't do it, so they come up with the 600. Well, that's caused some other downstream problems. So this is what we're working on right now. The other thing is immunity. Now, liability immunity, a lot of businesses, because of this ongoing COVID-19 and people going back and who contracted, whose fault, who's responsible, trying to limit the lawsuits, I says I'm fine with giving protections up for a period of time. The way that Mitch McConnell put a bill in, it had liability immunity through 2024. I says, my goodness, if we don't have a working vaccine, or a antibody that works, that people don't have to worry that if they contract the disease, it's not going to be fatal, then we're in trouble anyway. I said, why can't you at least adopt some language that says we will have immunity up until we have commercial quantities of the vaccine that's been distributed? So that would stop somewhere in the first quarter of 2021. If they come to those compromises, there will be, I think, a pathway forward. If not, it's going to be very difficult to give that type of protection and immunity and for that period of time. Right now, we're prepared. That we've been told and prepared to be back here next week to get this thing finished. So my gut tells me that we'll be voting by next Wednesday at the latest. We would vote by next Wednesday at the latest on a package. If not, if Steve Mnuchin and Mark Meadows tell the president they're at an impasse, I think that he would try to move in and act. It's hard for him to move in and act if the money has run out because it's the legislature that appropriates the money. Unless he has a slush fund or taking money from different projects that have already been appropriated, I don't know how he would do it. Now, with that saying, if you want to extend the $600 a week for another 2 weeks so nobody, that still money's not there. He has to come up with that money somewhere until we do something. So that would be quite challenging, but I can understand the aggravation of not having working legislatures able to come together on something that meet a deadline. I go back again. Why did we wait to the last minute? Why do we always wait till it's crisis to do something? We have plenty of time to work this out. We knew it was coming. Now, on the other side, they're going to say, yeah, but we didn't know if it would be worse, or we've been told that the COVID-19 would retreat. We wouldn't have as much demand as the warmer weather came. Well, we know that to be false. So we're in a territory we've never been. We don't know where this disease is going. So Steve, I really believe that we're going to come to an agreement. What we're down to now, the House gave us a bill that was $3 trillion. You've heard that, right? $1 trillion of that, so you'll know, $1 trillion was to go to states and communities like the $1.25 billion. That was $150 million. Okay. There's no way they're going to get $1 trillion for that. Republicans don't want to give anything at all to states and to communities, and they don't want to do anything. I think something will have to be done, and we have to give everyone a little bit of flexibility. I just think the way that West Virginia and many states have used it has been wrong. That's all. You have to have input from your elected officials. You have to have a special session on that. You should have had it back in April and finding out where the need's going to be. And there shouldn't be any first responder ever threatened about being laid off. Now, with all that being said, let's say we gave another $150 billion on top of the $150, and that means West Virginia would get another $1.25. They're going to make sure now that the money that they still have has to be used in a way that's going to be absolutely fine print out in law. And the new money coming will be under the same guidelines. That's what I think will. So that takes from $940 billion, let's say, that takes 800 off. So 150 is still going to be used, okay? Now you're down to $2 trillion difference, right? So now you have $2 trillion difference versus $1 trillion that the Republicans wanted to do. Again, I think what will happen, they'll meet in that middle somewhere, 1.4, 1.6, and look at some things that I just hope it's directed towards the need. And the only thing I will tell you is you've heard a lot of, they're throwing the Christmas tree out. They want everything, right? Democrats are throwing everything in. Republicans are putting money in for the Defense Department. My goodness, Steve, we just passed $760 billion for NDAA. Okay? That doesn't make sense either. So take all that away. I said you cannot fix the social ills that we have in a bill that's designed to fight a pandemic, a health crisis. So if that's the case, then we take that $2 trillion and $1 trillion and try to work between the 1.3, 1.4, 1.5, 1.6 in that neighborhood. That's my gut. And I think that would be fair. But now here's the other problem the Republicans have. They don't have all the Republicans who want to do anything. So they're going to depend on the Democrats to pass anything. Well, if you're Chuck Schumer or Nancy Pelosi, you're going to be carrying the water. You're going to get a little bit bigger piece of the pie. No different than when Republicans had total control. When they were in the minority, they had control to where we needed Republican votes to pass things, and they had more negotiating power if the Democrats weren't unified. So that's the stickling point right now. How far can they push it without the president jumping in doing what he wants to do or what he thinks he can do, and then you have a court battle and everything else is going to just delay things more. I just think the poor people that are in limbo right now are suffering, and here we are playing the politics end of it when we could be fixing this and helping them. PP, you haven't heard anything about PPP, have you? PPP's not, there's no, we have $128 billion, and we're putting more to it. We're going to be fine there. All they're saying is trying to figure out, well, for a person who's already got a PPP loan, if it was less than $150,000, is that going to be a grant? So you don't have to do the banks are saying it would take them forever to do the paperwork. So they're going to say, okay, is that going to be a grant? And next of all, if you want to go back and reapply because your business hasn't opened up, you still have unemployment, but you want to reapply again, can you show that you have 50% less of your revenue than you had last year when there was no COVID? That might be the qualification, and smaller loans. So they're going to target that, and minorities and smaller loans, and people got left out before. And there'll be people, smaller businesses, that can go back for a second tranche under certain conditions. That'll be worked out, but we're not that far apart on that one. So you'll have that, and you'll have some assistance to businesses, but the main thing is keeping our hospitals and making sure we have PPEs, which is personal protection equipment, and testing until the vaccine comes. And then making sure that the health departments have the personnel that they haven't had to lay off because no money's come through to them and they're really struggling, that they're going to be able to help distribute these vaccinations, around the local areas that they respond to, counties. That's where we are. That's more than you asked for, I hope. You know how things go. The 300 to 400 is enough. I always thought that a person that lost their job because of the COVID-19 and because of health reasons, we wouldn't let them open up, okay? Then they should be kept whole. That means whatever their salaries, the weekly salaries were. So if you take the average of 324 to 350, whatever, but if you take the 324 and you double that, then, you would take 400 on top of the 300, 700, you'd be keeping them fairly whole. And that's where I think it's going to be. I think it will help an awful lot of people. I can tell you, having that $600 on top of your normal, whatever your unemployment benefit would have been, has been a tremendous help for a lot of people. There have been people that have complained all over the state saying, yeah, but now I can't get people to come back as we start opening up because they made more by not coming to work and getting that $900 check versus coming to work, where it might be $600 or $700 a week. So we had that challenge there. And I think that basically that we just need to do this as quickly as we can so people just don't go clear back to where they can barely sustain themselves for any period of time, because this might go on until late December, early January. That's what we're working on there. And I hope it's not a hardship from that standpoint, but I would like it to see 100% of their salary, because if we're going to pay you the same as we did when you worked, because you're not able to work, we won't allow you to work because of health reasons. We have that obligation. Next of all, you asked the question on school and education, Brandon. The only thing I can do is give you my position would have been, you have plan A, plan B, and a plan C. Your plan A is everything goes back to normal, which we know is not going to happen. So you better have plan B ready. But plan A should have different options. And I think I've seen the State Board of Education saying there's going to be distant learning. Well, you better tell me how many kids are connected and not. You better tell me how many kids have computers and not. And you better tell me how we're going to supervise and make sure they're getting the instructions and getting the knowledge that they need. So distant learning will work if you have that capacity to do it. If you don't, that's another challenge. And I don't know if they looked at that. Next of all, We've had some schools now that have opened up early around the country. They open up for a day or two. They find out 25 kids tested positive, and they're shut down again. Or you have bus drivers, you have custodians, you have the cooks, you have all the necessary people that make a school function that shouldn't be vulnerable. Do they have the protective gear? Okay. Or they have any health concerns? We also know from this that a lot of children can be carriers and test positive and be asymptomatic. But they're carriers, so if they have somebody they're going home to, or if they're carrying it in the school and one of the teachers or teacher's aide or something like that has underlying health condition, they can be very vulnerable. So we're very much concerned about all of that. It's going to be hard until we get a vaccine and get antibodies that anybody can return to the normal that we had before. So they're telling us large gatherings. Well, I can tell you one thing out of personal experience. I have a granddaughter that went on July the 4th to a party. Well, by Thursday, another friend that was at the party called her and says, you better go get tested. I just tested positive. She goes and gets tested. And the whole group does. I don't know how many tested positive, but then they're all quarantined until it comes back negative. So never was sick, never had the runny nose, never had any symptoms, but tested positive. So I know from that end of it, it's very dangerous. But if they're going to do a soft opening on the 8th and find out how it goes, that's fine. Try a soft opening. Are you going to talk about football? Oh, my goodness, we're making Major League Baseball pay with nobody in the stands. How do you think we're going to have high school gatherings and not follow any type of protective guidelines? I don't know. And college right now is all up in the air. So and I'll go back to Steve asked the question. One of the big sticking points is how much money do you put towards education right now to keep education prepared to come back and not fall by the wayside to where we lose some colleges or we lose some opportunities that we have in our education system. So that's all. It's really, but you have to have a plan. Every state should have had a plan by bringing all your professionals, bringing all the teachers' organizations together, bringing all the service personnel organizations together, bringing all the communities together, and county by county, they should have been submitting a plan. Every county should have submitted a plan. Can you open? Can you open full? Can you open partial? And if you can't open, can you do distant learning? What's your challenges? I haven't seen a 55-county plan. Have you all? I haven't seen one. First of all, I think, Mark, all that's been agreed upon. I don't think there's a problem. I think they want to extend to 1,200. They're trying to make sure that people who passed away, they get their records up and running, that they don't get, I think, how many checks were sent to people that have been deceased because the records were not updated. So a lot of that, they're going through all of that. But also the 18 to 24-year-olds will not be left out of this next round. That's what I've been told that's in it. I haven't seen the final product because we don't have a final product. But I'm understanding that is not a sticking point on either side. That's great. If he's doing that, that would be great. I mean, that's exactly what the money that he received should have been spent for. Okay? Should be spent for. So if they're doing that, there's going to be much more need than 1,000, you follow me? So if anything, what we're going to do is basically making sure that every library in West Virginia has the ability and has hotspots that people can check out and take home. If they're going to work through the education system, we are too, but I'm just saying, you're not going to have an abundance of this. There's going to be a demand for it because it's going to tell you people do not have connectivity or good enough connectivity to do distant learning or telehealth or anything else they need. This is much needed, David. So, no, I'm very pleased if there's more being done by the state to assist in education or any other realm. VA needs assistance. The Veterans Administration, our veterans need because they're elderly. A lot of them are in rural areas. They need this connectivity. The education system needs it, and there's just a tremendous need. I haven't had one person push back, not one Democrat or one Republican push back that says, we don't need that. Ours is about a little under $200 million just for the hot spots. John Cornyn from Texas has been working with us, and now when we identify with the veterans and all the other areas where we know it's needed, it's about $1.5 billion. Okay, we had $1 million for the North Central West Virginia Airport, $560,000 for Mercer County, $560 for Mid Ohio, $368 for Raleigh, $227 for Logan, $166 for the Appalachian Region Airport, and $60,000 for Jackson County. These are airports that basically go through that process of the FAA that we have that submit for projects they're working on, and they're approved basically on as needed and the way the applications come in. So this went through FAA, and that's under our purview as far as appropriations. It's basically, airports are always asking for assistance for projects they have, that we help them and tell them to go through and put their applications in, and we follow them through. And if they have a problem with them, we'll try to help them with it. If it's a project that might not be of the category that the FAA is putting money out for, could be runway extensions, it could be repairs, it could be for taxiways, it could be for many, many things. And then basically if it falls in those categories, Shelley and I are on Appropriations Committee, we were able to work this and receive this money, I think $3 million or so for our state. But we have a lot of we have a lot of airports with a lot of needs, I can tell you that. Well, let me tell you, gang, I know that September 8th is right upon us, and I can tell you the hottest subject we have right now is school opening. And I'm sure you're hearing the same thing. It's just up in the air. And there's no clarity of what's going to be done. I think they need to know. We're going to, if that's what the state has decided, and they have checked with every county, what's the capacity, you better know what each county can perform before you start giving a statewide plan, because it'll be a statewide overview, but it will be basically enforced county by county and be able to make adjustments in case something happens, there's an outbreak or someone's tested. You have a kid, I think there was in the report I saw where a kid in a kindergarten or grade school or something was, in what part of the country, I'm not sure, but I remember seeing it, reading it yesterday, that then they had to, the whole class had to be quarantined. So anybody in that class with that child, including the teachers, are quarantined. So they're in one day, they're out for the next 2 weeks. That's the cycles you're running through and the things that could be happening. But I'm understanding the educators were all going to be, hopefully today, maybe meeting with officials from the state, the governor, whoever else, to find out if there's some logical plan that we know that we can do, and we know that we have a backup. If the plan A doesn't work, we have plan B. If plan B doesn't work, plan C. But there has to be a pathway forward, and every county is going to be able to tell me, with the number of children they have, can they basically deliver the quality of education the child needs. We were able to get the food to them. That was a good thing that we were able to do very quickly. We want to make sure that we can get their educational opportunities to them also. That's our responsibility.